is here with us today, and we're here to talk about the book that the Lord really blessed her with and gave her the intuition to write about it. And so now we're here with the Lemon Spirit. And here she is, Miss Rhonda for Shameka.
Hello.
I'm bad with names, y'all don't mind me. But okay, you can correct me anytime.
Okay, hello. This is Shameka Barron, and I am the author of The Lemon Spirit. And it's nice to meet you, Denise. So, this book came about probably about 4 years ago. I say it was incident, or I kind of fell in becoming an author, but I experienced my first anxiety, depression, things like that around that time in 2020. So I'm just interested in knowing, what do you think about the book and what you took from it, and were you able to relate to any of the stories?
Well, first of all, thank you for having me, Dr. Constance Dial. I appreciate this opportunity. And Miss Barron, thank you so much for having the courage, first of all, to articulate your experience with anxiety and depression through your writing of The Lemon Spirit.
Yes.
I absolutely I love this book. And what I love most about it is that you captured your experience in such a down to earth, relatable way that anyone reading this book is going to glean from it your experience, but not only that, they're going to glean from it a path or a method, if you may, of how to manage, well, first, how to recognize possible experience and possible anxiety and depression. After that, how to address it and be honest and upfront about it. And then thirdly, how to manage it. And so I applaud you. This book was so telling of individuals in our community who struggle, who struggle with anxiety and mental illness and don't address it. So thank you for your courage and your wisdom in sharing your experience.
Thank you. I appreciate that. And just about the courage part, I'm so happy you brought that up. I was so happy when the book was getting ready to come out. Like the night before, it was kind of like a kid for Christmas, like waiting for Santa Claus to come. I was so excited to share this book, and the next day came, and I went live, and I said, "Oh my God, I don't put my business out there." Like, what was I, what was I thinking? So yes, it was definitely courage. I mean, I was excited about it, but I realized when I hit that publish button, and went live with it, that people were going to read my story. So I just appreciate you meeting the courage, because it was definitely a courageous move.
And you know what, Denise, I have a question here because I know that you come from the medical field as well, and you are RN, and you've kind of seen how in our culture that we really don't want to deal with mental wellness. And we kind of see it as a taboo, or something's really wrong with you, when it's not, because there are services and things that we can receive to help us with that, right? So now when you were saying about, Ms. Barron, when you were saying about the courage and coming out, how did you feel coming out with your peer group?
Coming out with my peer group, I actually felt pretty fine. I also had a little mini book club, a meeting for the Lemon Spirit myself, and we actually had meetings on every layer, of the book. But it went well with my peer group, and I will just tell you, once that book went out, even though I was nervous, I was so amazed of how many women inboxed me on Facebook. People text me. Oh, they were crying. They was like, "Oh my God!" It was just
that's that point that I'm talking about.
Yes.
Because we'll walk around, and earlier this year, I had another book club that we did, and it was about our emotions and how we are, as women of color, we suppress and put down, and we always want to be 100%, which is nothing wrong with being 100%. But then in that, I think we need to recognize also that we can have mental, it's nothing wrong with
Yes.
it. I can say I'm having anxiety today, and nothing's wrong. You know what I'm saying? Like they put you like on a person. Like, oh, she got anxiety. It's nothing like that. It's just that what you're going through, and if you're not able to identify with that and make those corrections, then people can't get help.
No, they can't.
And there's nothing wrong with getting help, right, Denise? You're in the profession, and then you've written this book. Yeah.
Nothing wrong with asking for help. And so in our community, as Miss Barron mentioned in her book, we are not allowed to be, for the lack of a better term, weak. We're not
Come on.
allowed, we're not allowed to be weak. That's
Absolutely.
we're not taught that.
Mhm.
We are not taught that. We're taught to be strong and to be able to endure everything that's presented to us in our lives. And we are expected not only, now this is something else that's just not expected by our community. It has become an overall theme, I would say,
Mhm.
throughout humanity, especially in the United States, that Black women are supposed to, we're stronger.
Come on now.
We don't experience anxiety. We don't experience depression. We're not allowed to appear um, like we need support. We are the ones that are supporting everyone else. We're the strong ones. So this has become an epidemic in our society where Black women are seen as strong. And so we're not allowed to have those mental health challenges like anxiety and depression and feeling, blue, perimenopause or menopausal symptoms, or
Yes.
even syndromes after we have our babies. We're not allowed to have even
Postpartum.
postpartum
Yes. Mhm.
depression. We're not allowed that in our society. And so, not only are we really trying to overcome this and battle this in our community, we're doing it in our society as a whole, as Black women.
Yes, yes,
So
yes.
what I would say to you, I'm just so glad that you did it.
Thank
That's what
you.
we're saying, right, Denise? And we're here, and I'm here bridging this gap between the old and the new. With the older generation, the more mature generation. I don't want to say older, more mature generation, and we're bridging that gap because we know that it was a problem, and I love the fact that you took upon yourself and let Father God use you to
Yes.
be able to come out and write this book because it's
Yes.
so needed and
Yes.
so timely.
Yes.
With all this stuff we got going on in these streets,
Yes.
in your streets, everybody's streets, right?
Yes.
So we really want to open this door for more communication like this.
Yes. And I
Yeah.
appreciate that, Dr. D. And sometime I've been invited a few places to kind of speak about mental health and anxiety. And I remember a therapist, I know she invited me to speak on a panel, and it was all the rest of them were therapists. And I was like, I don't feel comfortable here. Like, I don't. And she was like, no, you belong here. You know this, and what better for the audience of people to
For
hear.
a person
Yes.
that has
Has
experienced
experienced
it
it.
and then come out
Yes.
on the other side. Because sometimes when you just read a book, you say, okay, they did that. But to have you in
Yes.
person,
Yes.
young, where they can see you, you can identify with
Yes.
them, is nothing more and powerful. No, no, nothing more. Nothing more.
And I would like to say this, Miss Barron and Dr. Dow, that with the book, you've actually given others permission to acknowledge that they have the right to even express how they feel. So, you sharing your experience and your story has given others permission to come out and say, I identify with that. That resonates with me. That's how I felt. Oh my, I thought I was the only one. So it's very empowering. I just wanted you to know that it's very empowering.
Thank you, Denise. I really appreciate the feedback. Just hearing from that, it's always refreshing, to hear other people's perspective. And even though I wrote this book 4 years ago, I mean, it still can be applied daily. You know, this walk with anxiety, this is a daily thing. This is a monthly thing that, you know, we have to continue to work on. So, yes.
Absolutely. And we want everyone here that's come on with us today, and you'll be watching this and you go to the YouTube and you'll go and watch the whole book reading. We really want you to know that you have someone that you can reach out to and check for resources in your area so that you can get help that you need. Don't you agree with that?
I totally agree.
Yeah. So now, when you were here in Mobile, what places did you go for help? I know I read in the book about a therapist.
Yes.
And what are some local places they probably could go? Maybe if they're financed or they don't have the insurance. What have you found to be here in Mobile, which it may be different for your state, but at least it can be a beginning place to start?
Well, before I started seeing someone, I kind of used the EAP. I think if you work, most employers have the EAP, which basically you can get a therapist. Actually, at the current job I am now, you can get up to 6 sessions, and actually anybody in your house can get up to 6 sessions. So I started with that at first. Then I started, kind of researching therapists. I found my first official therapist was from Birmingham. I was really having a hard time, and I guess everybody else was, because I couldn't find anybody in Mobile. So first therapist was in Birmingham, from Yellowbird Counseling. And I had to go to therapy every week. I mean, I had to really go. I mean, it was $50 a week, but I had to do it. But
And
that
it's
was
the
my
best
first experience.
investment.
It is the best
In yourself.
investment in myself. That is exactly true. Yes.
Okay, we thank you all, and we hope y'all enjoying so far. And Denise, thank you so much. I appreciate you for your time and your talents and all that good stuff you got going on, girl. I love you, and we'll see you next week.
Absolutely. I'm
Thank
excited. I can't
you.
wait.
I
Thank
know,
you,
right? We're
Denise.
gonna be here together. Have a
Yes.
great one.
Okay.
You too.
Bye.
Thank you.
Okay, hey. So I'm Lady Sarah. I'm a licensed mental health therapist, and I have my own, my own private practice here or outside of Atlanta, Georgia. I also provide Reiki, coaching, and I deal primarily with women of color, professional women of color. So it's kind of my niche. So congratulations, I want to say, on writing the book.
Yay!
Yes. I really, really enjoyed your perspective and your bravery with regards to taking this task on. So, do I ask my question now?
Yes.
What are you doing now to maintain your mental health in light of the recent political climate? How has that impacted you, and what is your plan as we're moving forward in this year?
That is actually a good question, because I did not think I was so emotionally, I guess, invested in this thing, until, we went through some election and, some things like that. And it actually was pretty triggering, caused some tears, and it was triggering as far as it's not just about Kamala winning or anything. It was triggering the disrespect of her. And I've been in management for 20 years, and as a Black woman, and it is so difficult. People don't respect you. You really have to go through a lot. So that was it was triggering, just knowing how it feels like we can't ever do enough. We can't, no matter how many, I guess, degrees, whatever it is that you have, we're not respecting and have to go through that. So me, I was just kind of reflecting on it or things like that. I was tied up in emotions for a good little while. I'm like, why am I crying? I don't know these ladies,
No, but you know what? I thought about that because as I read your book and the bulk of your, a lot of what I took away from your book was tied to your career, your professional life, the anxiety, the depression, and even the expectation around where I should be and how I should be showing up in my career or in my family or my thing. And so I just felt like this could have had some impact as well, because it's almost like different. You're picking up the same scenario, just in a different time and season. Of course, it's directly, but the implication, there. So I wanted to kind of hear your thoughts and how you were planning to manage that in light of what you have put out there, because I think this is a great opportunity, even now the timing of this, to even kind of give this to women with regards to, like you said, the plumb line is constantly moving. It's never enough. So yeah.
That was a great question. Thank you.
That's my question.
Thank you.
So I really didn't have too many questions for Shameka. I think, yes, you are an author, and the book was absolutely phenomenal. I just wanted to share the part that stuck out the most to me.
Yes.
And that was in layer 3, the blooming season.
Mm-hmm.
And for me, it was say no to the invitation, no excuse, just no. And being in therapy myself, it was something that I needed to work with, letting people know that the answer is just no. For me, if it's not a heck yes in my emotion, then it's a heck no. So yeah, so that part of your book definitely resonated with me. Thank you so much for sharing your experience, and know that I will be passing it along to someone who I believe can also relate to the book.
Well, thank you so much.
Thank you for your comments and your feedback. Love you and blessings, and I love you. I'll call you later. Love you.
Love you. Bye.
Bye.
My name is Renasia Jones, and okay, so this book was about anxiety. I would say I'm a first year teacher as well, a pre-K teacher, and I just remember I had anxiety going into it because everybody will say this and that, and I guess it just rubbed off on me, and I was am I gonna do my best? Is the kids gonna like me? Long story short, they love me. I'm doing good. So yeah, it was just all about me getting into my head. So, and then another thing, growing up, people would just say we young, y'all don't got nothing to worry about, y'all don't got nothing to stress about. And one quote in her book, she said, the worst part about being strong, nobody ever asks, are you okay? Girl, nothing wrong with you when the whole time, even though I'll say it's bad nowadays because people push that off on little kids, stuff nothing's wrong with you, or you ain't going through nothing, you too young to have problems. And nowadays, it's just a lot of kids are mentally drained because they don't have nobody to go to and talk to these problems, because everybody's always just saying nothing's wrong with you, you don't got nothing to worry about, you too young. And that's why I would say most kids are committing suicide because of that. Wow. And I say I play not the suicide part, but I play a factor in that too. Growing up, people will, say that to me when the whole time. And then just with being in school, it's a lot you gotta go through. Plus and working, and then I said, I'm dealing with kids too. So sometimes I need a break too, or I just need time for myself, because dealing with school, going to work, and then also outside of that, just having problems of my own. So it's just, yeah, it's a lot. So I would say what y'all what everybody said in here, I got a lot from it, because it's a lot of people that's really going through that and don't know how to deal with it, or don't have nobody to talk to. So they just keep it in and just. And that's not good. That's another thing. It's it's not good to just not what she said. It's not good to just keep it. You gotta just do something. And then most people what I was gonna say, I'm going. Most of the time people are just like you said, just stay busy, just not think about stuff. And I say I'm affected in that too, because most people oh, you always going out, sit down somewhere, whole time, I'm going, I might be going through something, I just need to get my mind off of it, so I just go out.
That's right.
Take my mind off of it.
Well, there's nothing wrong to me with you, You work hard and you play hard. I really, we're avid about that. If I work hard, you work hard, I think you deserve to do different things.
Yes.
And to reward yourself, whether that's going out to dinner or whether that's going to a game or whatever it may be, just to get away, because it's more than just work, home, and school. Work,
Yes.
home, and school. You know, it's another part of you, so I get that. Honestly, I get that. So that's good. Go ahead. She's
Yeah.
going to say something too.
I like what you said, and there's nothing wrong with doing things, because they're gonna tell you that in therapy, like, okay, this is going on for work, but what are you doing on this side? You know, where work is not bothering you. I think the problem comes with if every time you doing something, like, you know, why you out or why you doing stuff, because I don't want to think about this, I don't want to think about this, because whatever's bothering you, you need to deal with that. And it was my first therapist that I had that gave me an assignment, because I did go somewhere every weekend. It wasn't necessarily out, but I just had to be physically doing something. And she gave me an assignment. She said, what would happen if you had to stay in the house, like work and stay? I want you to go nowhere this weekend. For the next 2 weekends, I don't want you to do nothing. And I was like, oh, why? You know. Because she said, as she was listening to me, it would sound like I was hiding from something. But she said, what happened? She said, why are you afraid to be at home? I said, well, I'm not afraid to be at home. But, you know, home, you just reminded of, you know, everything you're dealing with, your problems. So sometimes you just want to take it out. So it's, you know, it's nothing wrong with doing anything. We just want to make sure it's balanced. And then
It's balancing.
as far as her becoming a teacher, how she was saying, people were telling her stuff, and she was, you know, getting anxiety and stuff, in which that's probably known. And I think just not only in that example, we also have to be careful that we don't take on other people's fears. You know what I'm saying? Like,
right there.
because people, you will be feeling fine, and then
Your
all of
ear
a
gate.
sudden,
Guard your
somebody
ear
say
gate.
something. Somebody
Guard your
sows
ear
a
gate.
seed, and all of a sudden I'm
It's a
anxious
seed.
about something that I was just excited
Excited
for.
about.
Yeah. So I'm
Girl,
afraid of
you
something.
sure you want to do that?
Yes, that's it.
Girl, I don't know about that.
Yeah.
Well, you don't know about it, but I do.
Yeah.
And then you just need to kind of
Yeah.
say, that's for you, but this is for me.
Yeah.
Because you have to set that
Yeah, you have to set
boundary.
that boundary.
Yeah, because they will make you afraid.
There's a lot of that. I even go to my grandma and I tell her like when people was telling me about like becoming a teacher, they was like, "You sure you want to do that? Like, teachers don't make that decision."
All my life I heard it.
Yeah,
But that's not why you going to teach.
No.
yeah.
It's
Like, I'm
rewarding,
doing something
and then
I
God's gonna provide
You
it
good
for
at
you.
it. Absolutely. They love you. And you apparently.
You can take education. Remember I told you that? And she did come to me. I said, Ronasia, you can take education and it can go wherever you want it to go. That's just your beginning. And I said, first of all, who's telling you not to do it? Are they in college? Where are they at? What do they do? Do they have a degree? And she like, so you can't speak? Hold that. Okay. Close that. Okay, Miss Ronasia, Deasia.
My name is Deasia Jones. I'm 22 years old. When I first got this book, y'all, I ain't gonna lie. Miss Bunny gave me this book and she like, Grandma said read it.
Grandma said read it.
And I was like, Bunny, what's this about? But I'm glad I did pick up the book, because the first thing I did see was the quote of my sister said, the worst part about being strong, nobody ever asks, are you okay, girl, ain't nothing wrong with you. And people, we get that a lot, because the whole, how you gonna tell me something that really what it is? So, and then I also like when she said, depression is walking on eggshells and putting on a happy face so that no one sees the real you. If anybody know me, I'm always laughing, just playful, like, especially at my job, act just like the kids. Like, seriously, I act just like them. It's like, don't listen to me now. I have my days. I have my days when I actually do go through something. Like, I feel like, just like her, when she was saying she didn't get the job and she felt like her life was over. Like, that was me when I applied for nursing school.
Yes.
Like a year ago.
Yes.
Yeah, I'm not gonna cry. I just sound like that, but I'm not gonna cry.
Okay. I'm glad you're not, because if you do, then I will.
So let's not do that.
But I applied to nurse school a year ago and I didn't make it. And I just feel like my life was over. But I just had to like come to my senses. Oh my God.
That's just what I'm saying, baby, right there.
Hey, it's okay. That's why we're here, sweetheart. Encouragement. It's okay. Yes, yes.
You need to.
It means it's just not for you right
That's
now.
right. Everything
God had another
happens
plan for you.
Everything
Things
happens
happen for a reason.
Can I say
So
something?
there was something else meant for you.
Exactly.
My daughter, who's a nurse and worked, she did not make it into nursing school either the first time. And she actually was devastated. We all were. And I'm gonna tell you this. She ended up walking away for about a year. And she went to class to get her CNA. And she started working. She passed the state test and she started working at Providence. Then she applied again and she got in. She graduated and now she's a nurse. And what God told me was, Stephanie is a hands-on learner. Going to nursing school the first time, she would not have done well because it's all book. It's all book. But once she became a CNA and she worked in the environment, she excelled because she was able to work in that environment. For whatever reason, God did not allow you to get in that first time. There is a reason. You may not know what that reason is. But do not give up on your dream. In the process, my baby, she was a single parent. She has my granddaughter's gonna be 8. And she was a single parent. She was going to nursing school and she was a CNA. And she did it. I'm telling you, God will give you the grace to do what you need to do. Don't you give up. You take those tears and you let them encourage you to move forward. Do not let that be the end of it. Do not. God has given something, has something great for you.
And she's really a good teacher, and DeAge is really, really a sweet person. She take it in, and all them parents love her, and all the kids love her. Everybody want to go home with her. You know, like your baby don't even want to go to you. He be reaching for DeAge, and I'm like, girl, this is mama. Go home with your mom. But she's really good with that. So, yeah. Okay. So
I'll share with you later, DeAge.
Because Miss Karen can attest to this. Miss Karen was around a long time ago when I was trying to get into nursing school. I graduated at 17. I applied to nursing school around after my first or second semester in college. I was 18, going on 19. Did not get in. I said, okay, well, let me just keep trying. I was at South Alabama. So I kept on going, and before you know it, I was almost done with the bachelor's degree. I had applied 3-4 times, could not get in. Here I am, 20. Go to University of Mobile. I'm still trying to get in. I had graduated, got my bachelor's degree, applied to the pharmacy program, and got into the pharmacist program. But I wanted to be a nurse. Went, applied again, 21. Still didn't get in. Okay, I graduated at 17. Applied again at 22. Got into University of Mobile's program. Ended up having my baby early. Got kicked out the program because I was in the hospital. And at 20, going on to 23, I applied to Bishop State's LPN program. And I got my LPN when I was 23 years old. But I tried 18, 19, 20, 21, 22, and I did not get my first nursing degree till I was 23 years old.
Our story is very similar.
Yes.
6 no's, but it's okay. I'm a nurse practitioner.
There you go. Yeah.
A no means nothing. What matters is your effort.
That's
And
right.
we keep going because what's meant for you, God is going to give it to you
That's
when
right.
it's your time.
It's
And
your time.
and for every no, I found another way. I
That's
found
right.
something else to do. I just kept on going. I got 6 no's. And 10 years later, I am a nurse practitioner.
I stopped counting my no's. They told me no when I first started. I had worked at infirmary 5 years as a unit secretary. Everybody said go to LPN school. I don't want to go to LPN school. The RNs come out of school and I'm the unit secretary. I train them. I said they can't walk and chew gum at the same time. Applied to Bishop for Mobile Infirmary's program that they would pay you. They pay for your nursing if you agree to work for them. They turned me down. My math skills weren't good enough. I enrolled in Bishop and took math. Went all the way back, took math. Every math I could. Took the test again. I got in Bishop. Took courses at Bishop, but I wanted to go to the University of Mobile. Transferred over there. They didn't take Bishop's English. Okay, I'll take the English again. Got the associate degree from the University of Mobile. Time for the BS. Let's go to South. They had a wonderful nursing program. They didn't take Bishop's English. Okay, I had to pay for the English course, but take a test to say that I knew the English. I passed the test. So I never had to go to class, but I made a grade. So I got my BS from South. Now I have a dual master's from the University of Phoenix. And I worked in nursing for 44 years.
All right. Let them know win.
Never know. Some of them don't want you to make it. But that one note, don't let it stop you.
Don't let it.
Exactly.
I'm so proud of y'all.
Claudia, I told Dr. D, I said, everybody spoke. And I said, Claudia spoke, but she ain't said nothing about them sticky notes. But we going back to
No,
her.
go look at that book.
I said,
Show 'em your book.
we want to know about, I was like, I need to know what she was saying or what she took from the book. So I said, we going back to Claudia to go over them notes.
I do not like to write in my book.
I'm
Okay.
sorry.
That's why I have so many sticky notes for me to refer back to them.
Okay.
To do some other research. That's why. But this is a wonderful book. I got a lot of information, and my notes are for me to refer back to. Everything that I highlighted. Some people highlight things. I wrote it down so I can go back and relate some other things.
Could you pick one thing out? Go to something and tell us.
One thing. Let's see.
Take your time.
Yeah.
Oh, this one said, you said bitterness, hold grudges. I'm not the person to be bitter. I don't hold grudges. I like that statement. I put question marks by it, and I was going to ask you to, you say bitterness, hold grudges. I just want to know your input on that.
Bitterness just going through, like it started with, working on a job or promotion and stuff. And some things you want, you took the test, you become resentful. You become bitter because you think somebody took what's yours, but can't nobody take what's yours. And it's just something I just realized, like bitterness, it just hurts you. You just walking around with an attitude. Like, why you walking around with an attitude and the people going on. So I just know life is too short for me to be bitter. Will something sting sometime? Yes, I'd be disappointed, but I don't need to wallow in this thing because I don't need to be bitter because God has plenty, to give out plenty opportunities and things like that. And actually, when I didn't get that management position at the time. And this is another thing about the no's. Sometimes you have to thank God for the no. Sometimes you have to thank God
Saved your life.
for the no.
Saved your life. Saved your life. Because I know some no's saved my life.
Yeah.
Literally.
Thankful for the no. you know, because some things I be like, oh, I want it. Because I'm sure everybody got experience. You wanted something so bad, and I'd be like, oh, God, I'm glad that ain't me. What was I thinking? You know what I'm saying? So, yes, no, it's a good thing. But, yeah, just bitter. I just learned with me, you know, because I had some unfit forgiveness. And the reason I know I was locked up in that thing, I was having dreams about it. Like, it was just too much, you know, in my psyche, and I had to let this thing go. You know, while I'm holding this, I can't get what God's trying to get me while I'm holding on to this thing. So, yes.
Yeah, because you know what? You can't go forward walking and looking backwards.
No, you can't.
You can't. So you got to let that go and then walk forward, you know, to your neck. Keep moving. Absolutely. I think the thing is keep moving. One thing.
Referring to the nose. Yes, the nose can sometimes, in a lot of cases, they are good things, but we don't realize that at that time. That's their way to excel. And each one of our stories that you gave, it was an acceleration from the no. It was. Because you can just think, oh, well, shoot, I can just do this, I can just do it all. Mm-hmm. No. Sometimes you want to go and thank that person for saying no. A lot of people that have been very, you know, have excelled and us very successful, they have all said how many no's they have to go through in order to get to where they are. And they are happy that did happen. At the time, no, they weren't happy. Right. But that's because we did not understand it. And I'll say this and I'll be done. It goes back to an old spiritual hymn that my mother used to always say. You will understand it better by and by. Amen. That's good. That's good.
Ooh, that was great.
It was amazing, right?
It was amazing. Y'all was giving me therapy back too.
Yeah. Like, didn't we have a therapy day? I don't even know who to pay. Because we have just that therapy all the way around.
I'm like, she said that. Okay, yes, ma'am. I'm taking that. So I'm taking all these nuggets, and that's what it's all about. All of us just, you know, helping one another. You know, you just take what it is that you can relate to, you know, and apply it to your situation. But I appreciate the feedback. I just never get so, I just can't believe it. Because I just didn't think people would gravitate. How impactful. Because we already know anxiety, mental health is like a negative thing. And that was courage to put out something. I was telling them earlier, like I was so like the night before it was gonna go live on Facebook, I couldn't sleep. I tossed and turned. I was like a kid on Christmas. Is Santa Claus coming? I was ready. But the day I launched it and I hit that publish and like, I was like, oh my God, what have I done? Like, because these people finna know my business. That's exactly, what I said. So I just really, really, I don't take your compliments, your feedback or anything for granted. It just lets me know I'm on the, right track, and God just, he's just using me. As a manager, I used to, work in management, and I would have employees that would kind of come to me, and they would be coming to me dealing with stuff, and I'm like, why they keep coming to me with this stuff? Mm-hmm. And God said, you dealt with this before. But they just would come and tell me, Miss Barron, I need to talk. Some employees don't work at that place anymore. Miss Barron, I need to meet up. I just need to talk about some things. Okay, well, call me. We're going to go out and meet. So I just don't take it lightly, and I just appreciate you all. Thank you.
I'm so glad that you all came out. And we're so glad that you took the time to come over here with us. And I had, I've been knowing her for quite some time. Yeah. And then when I found out about a book, I just could not share it. And when I read it, I was like, oh my God. And when I saw that yellow, because yellow is a color of power and all that, I was like, I love this. And so that's when I said I had to be with you. And I'm so glad that you came out, and all of you took your time to come out and encourage her and pass the book on. So now when we get ready, we're going to get ready to pass it on. So from Dr. D to you all, peace and blessings. Y'all have a great afternoon. Blessings. Bye.